all the patients that I told you about in this study had a mild condition with the COVID-19, that was only slight sore throat, cough, fever that lasted a couple of days, then went away, some muscle pain. And thereafter, they developed their neurologic manifestation, which are also now called the post-acute sequelae of SARS-CoV-2 infection, or PASC, P-A-S-C. It's a new acronym. So we're trying to understand in my lab why some patients developed the long COVID syndrome and some patients who have the same mild presentation never need to be hospitalized, remain asymptomatic after that. We think is that it is caused by dysregulation of the T cell response against SARS-CoV-2 protein, where the virus has come and gone, but has dysregulated the cellular immune response mediated by T lymphocyte to think that something is abnormal in the brain or the meninges and need to be attacked by the immune system. So this is ongoing in my lab, and we have a study where we look in the blood of those patients for those markers. In addition, we want to understand whether some of the SARS-CoV-2 laboratory negative have actually been exposed or not to the virus by looking also at their T cell response, because T cells have memory and they don't lie, and they can be interrogated in presence of viral peptides from SARS-CoV-2, and then they will produce cytokines or a certain pattern of response that can tell us, yes, these T cells have been exposed to the virus, or no, they haven't, right? And so that could explain why some people who go below the detection level of even the more sensitive antibody assay, which are the newer ones looking for antibodies against the spike protein of the virus, not the nucleocapsid like the first antibody test, have actually been exposed to the virus. And this is important for them because as they come with their long haul symptoms to various, physicians' clinic, or even try to get seen in COVID clinic, they get rejected because they are negative, right? So if they are negative, they can't possibly have COVID, right? Which makes sense if you think of other viruses like HIV, where somebody is HIV positive, they are going to remain HIV positive for life, regardless if they are well treated or not. But there's always a serologic marker because the tests are very sensitive and remain positive forever. SARS-CoV-2 is not the case, right? So the tests are not so good. And then others have showed that there's a rapid decay of antibodies in the blood over time, which allows people, unfortunately, to get reinfected by the virus, despite the fact that they were infected the first time and that they developed some antibodies. So that brings a stigma to those patients who have the same long haul symptoms as those who are laboratory positive, but they get rejected and disenfranchised, unfortunately, by the medical establishment, which actually adds insult to injury, and it's unfortunate.